our caregivers need care too, especially during the past 2 years. Hard to believe, 2 years. And the toll COVID has had on our healthcare workers, nurses may be experiencing physical or emotional burnout or even moral distress. Here today to talk about the support available to nurses is Mandy Richards, Executive Vice President and Chief Nursing Officer at Hartford HealthCare. Good afternoon, Mandy. Thanks for joining us.
Thank you so much for having me.
All right, so what are some of the support options available to nurses to help guide them through these tough times?
Yeah, one of the first things to remember is taking care of others starts with taking care of yourself. And so fortunately at Hartford HealthCare, we are one of the few healthcare organisations that have a Chief Wellness Officer and a department dedicated to the wellbeing of all of our colleagues. So three quick things that we've been doing for our nurses in the last couple of years, I can't believe it has been 2 years now. It starts with how do we train our leaders, where they are focused on specifically, providing them with the skills they need to lead through a crisis and support their teams, building cohesiveness amongst their teams so that they can actually support each other on the job. The second thing we've done is we've launched a wellbeing index, which is a digital tool that can live on your computer or in your palm of your hand, so with your smartphone, where all colleagues can actually check in on their own wellbeing and resilience. And it compares them to similar people in the similar roles, so nurses across Hartford HealthCare, or nurses nationally, and then it helps them to track over time. They can take it each month, and then it also helps them if they need a little bit more support, it shows them what resources they need. And I'm really excited to see that since we started this in October, nurses have been our colleague group that have engaged in this tool the most, so I know that they're checking in on their own wellbeing. And then lastly, and the thing I'm really excited about is our nursing peer support program, which is where nurses can actually reach out to a peer and get support during a really stressful time.
All right, talk to us about the peer support program offered at Hartford HealthCare. What is this program?
So the peer support program was actually just that. It's knowing that people who have walked in your shoes are the best listening ear. And so the peer support program was created for both providers, advanced practitioners and nurses. And it's really looking for volunteers that have been through difficult times themselves. And they're trained to help be that listening ear for nurses or for other colleagues going through a stressful time.
What does a peer supporter do?
So basically what they do is they are volunteers and they're there to have a conversation. They're not there to be the licensed psychologist. They're there to have a conversation, but also to know when to refer them on to perhaps needing more help. And so it is an immediate, within 24 hours, they're on the phone and they're chatting through a difficult situation. And often they're not from their same area they work within the health system, which is sometimes a good thing. And they're there as a peer supporter and mentor.
And Mandy, how do Hartford HealthCare nurses access peer support?
So we have created an internal site where there's a lot of different resources, both internally and externally, but there's a number that they can call or an email, and they will get a response within 24 hours with someone to be speaking through their difficult situation with.
All right, Mandy Richards, thank you so much. Great information and great job keeping those nurses healthy. We love it. Thank you.
Thank you so much for your time.